Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum, the official podcast of the National Community Pharmacists Association. I'm your host, John Beckner. We're glad you could join us today. Today's subject is the NCPA Executive Residency, and NCPA was quite fortunate this year to have two executive residents, and I'm joined today by one of them, Charlotte Nazar. Charlotte, great to have you with us.
Thank you, John. I'm excited to be here.
So I think it would be great for our listeners' benefit for you to talk a little bit about your background and what did you do before you came here?
Sure. Yeah. So I'm originally from Harrisburg, Pennsylvania. And so before I came to NCPA, I did my pharmacy school education at the University of Pittsburgh School of Pharmacy. And while I was there, I wasn't really sure in the beginning what I wanted to do. I thought I wanted to go into like neonatal, pediatric care on my pharmacy route, but Pitt has such a great community pharmacy presence. And during my second year, we had a lot of workshops where they brought in a bunch of different community pharmacy leaders. And that's when I was sitting in the room. I was like, I think this is what I want to do. So I kind of pivoted a little bit and switched to a community pharmacy focus. And I got to be part of an area of concentration called Community Leadership, Innovation, and Practice.
Oh, wow.
Yeah, where I got to learn about how community pharmacy operates and manages and how the workflows look. And I got to take more classes focused in that area. I got to be a part of several organizations and student chapters while I was at Pitt, which was a really great opportunity just to see all the different sides of pharmacy, which I really enjoyed. And during that area of concentration, I also got the opportunity to do some research with my state CPESN network and got to look at some different data that they were collecting on some COPD and asthma. And that really got me interested in my state network for CPESN. So I was able to do a full year internship with them, learning how they do their data analysis and how they talk to payers and all the really cool opportunities that came through that. And that really just solidified for me that I was really interested in independent community pharmacy and kind of started to pursue things in that direction when it came to my APPE year.
That's great. I know the University of Pittsburgh has a great reputation for their pharmacy school. You must have been involved with Melissa McGibney there?
Yes, she was one of my biggest mentors there, but also Kim Coley, Sophia Herbert, they all really helped me. And Stephanie McGrath, she was my CPESN MNF, so she was great.
That's great. So I know with the executive residency here, we tend to involve residents in a lot of different activities. Why don't you share some of the things that you've been involved with here?
Wow.
You can also talk about your favorite things that
Sure.
you've enjoyed doing.
I would say in the NCPA residency, they have you do kind of everything. You get to really dive into all the different departments and different opportunities that we have. I've gotten to do grant writing. I've gotten to help set up and do webinars and look at continuing education sessions. I've also gotten to do grants. So the grants that I was talking about, we've gotten to help with cardiovascular health and diabetes and a bunch of other things. And we got to see the whole process through, like how to write them, how to implement them, how to really scale it afterwards, and things like that. I got to help plan a lot of things for our annual convention. I got to help with the business plan competition, which is always a hit, I think, every year. So really got to be the point of contact for that and setting it up and all the behind the scenes and running the program. I also got to help with the poster symposium for anyone who presented posters at our annual convention. So really a big range of things that
You've
we've
been a
gotten to
busy
do.
lady.
Been very busy for sure.
So I want to drill down a little bit with your work with grants. I mean, when I started here and I left at the beginning of the year, I was here for 12 years, and grant writing was not a big focus, but it really is now. And it sounds like you've been involved in grant writing from kind of A to Z.
Yes.
Is that
Yes.
accurate?
Yes, I would say they let Jacqueline and I kind of jump right in when we first started. It's been a big thing in our innovation center at NCPA. We've been really taking off on grants and applying and finding things that will help bring money and patient outcomes back to our pharmacies.
Yeah.
So we've gotten to do, the whole thing. I think in our first 2 months, we got to write our first grant. And Jack and I were so excited when we first got it. And then we got to kind of implement them. And I think we've had over like 5 or 6 grants that we've helped to kind of put on.
Well, part of that process, I think, is just knowing what's out there. A lot of times you don't know what you don't know, and when you start doing some research, there really is a lot of money out there to apply for.
There definitely is, yeah, and it's cool to see the behind the scenes of how you talk to people and network with people at different conferences to help bring those kinda to light, and you sometimes it's just through, like, hallway conversations that you somehow end up with a grant, because they see the value of NCPA and what it can do for its members.
I know one of the other things that you've been involved with, because it was one of my projects when I was here, and that's working with ADCES.
Yeah.
What can you tell us about what you've done
Yes,
working
well,
with that group?
I would like to say thank you for passing the torch over to me, but John was one of our, subject matter experts for this grant with it's called Match 2320 with the CDC and ADCES focused in diabetes, and he passed that torch on over to me, and I got to help do the subject matter expert part of Strategy 9, which is helping with, um, diabetes, DPP and DSMES programs in pharmacies. And that's been such a cool experience, being able to help different recipients of this grant um, learn how to implement these into their pharmacies or presenting to them on how community health workers could help them
Exactly.
with these programs and services so that it doesn't all fall on the pharmacist and doing a bunch of other things with billing and reimbursement because that's one of the main struggles I think for pharmacies is figuring out how they can get paid for these services since it's a little different than the other healthcare clinics that are doing it.
Yeah, that's certainly been an ongoing challenge, and you know, we both attended several regional meetings, and that the issue of billing and reimbursement continues to come up. But I think one of the things that was really neat to understand is that people are using community health workers to be involved in implementation and operationalizing
Yeah.
that program, with these pharmacies.
Yeah, and that's been a big highlight, I think, in a lot of our grants that we've had. We've always highlighted using community health workers, and in some of our grants, even having them train technicians to be community health workers, just because we see the value of it and how much not only the value for the pharmacy, but value for the patients, having someone that, you know, eats, sleeps, talks like them, helping them through different situations that they might be in.
So looking at all the activities that you've been involved with, and I know you've got your favorites, but in terms of things that you may see as the most valuable as you move beyond this residency program, what are your thoughts about that?
I would say that being a subject matter expert has like really helped me, I think.
I was hoping you'd say.
Yeah, I think it really made me come out of my shell and be more confident in who I am as a professional. So not only those kinds of skills, but also like being the only person in the room who might know something and having that pressure and making sure that I know what I'm talking about. So I think that was a really valuable experience for me. I would also say that being able to go through every step of a grant process has been really valuable for me, and I'll carry with me throughout the rest of my professional career, I believe, just being able to be a part of all of that, even just learning how to contract and doing all those different things that you don't really learn in school. Another really valuable project that I've been a part of has been helping to revamp our fellowship program that we provide with,
Same.
yes, with NCPA or with CPESN,
Right.
and we, had decided to focus in really on medication synchronization and how, pharmacies can implement that, and we decided to do, like, a hands-on approach. It's a 9-month program where pretty much every week, we are meeting with them, every week but 1 in a month, we meet with them, and kinda handhold them through the process of enrolling patients, setting KPIs, doing all these different things to have a successful appointment-based model
Right.
and kind of always there to help them and guide them. That has been really interesting to me. It's something that I've always been interested in since my P2 year when I decided that I wanted to do some
Yeah.
community pharmacy work.
So has being here the past year caused you to maybe take a closer look at association management or pharmacy ownership?
Yes. So originally I wanted to own a pharmacy. That was in my right out of graduation plans I wanted to do, but I had done 2 APPE rotations in association management and that kind of really solidified it for me. I did one with NCPA and then I did one with my state association with my lovely CEO, Victoria Elliott. She was amazing, really took me under her wing and showed me the ropes. So I was kind of always on that track, I think
Right.
I decided, but I would love to own a pharmacy at some point. I just don't know if it's in my next 5-year plan, but I think it's gonna always be in the back of my mind.
Well, that's great that you may be looking in that direction. So final question for you, advice for future residents. I mean, NCPA really puts a lot of work and devotes a lot of resources to its executive residency program. Uh, for those folks that may be applying down the road, what advice would you have for them?
Yeah.
It sounds like it's been a good experience
It's
for you.
been it's been a really great experience. I've really enjoyed, um, all of the different projects that I've been a part of. I guess my biggest advice would be to dive into the things that you're really interested in. I think when I first started, it was really overwhelming. There were so many different opportunities and projects and things that were going on. And it took me a while to kind of get my footing and decide, like, hey, what do I really want to go at? But I think if I could go back and do it again, I would have just gone for it.
Dived
Dive
in.
right into the
Yeah.
things that I was interested in and really getting to do that. But it still worked out for me in the end.
Yeah.
But
Well, I'm glad it worked out. I enjoyed working with you during my time here, and I wish you the best of luck moving forward.
thank you so much, John.
And for those that tuned in, we invite you to check with your preferred podcast platform to listen to Independent RX Forum. Thanks for tuning in.